I have the great pleasure of introducing James Kariuki as our next presenter. I work with James on a number of donor-funded projects in low and middle-income countries, including in Africa, where James is originally from. James works for CDC, and he is one of the two primary authors of the version 2 of the Aggregate Data Exchange Profile. James, the floor is yours.
Thank you, Derek. I hope you can see my first slide.
Yes, we see it, James.
Okay, so during this session, we will present an overview of ADX profile, and the attendees will learn about the use cases surrounding aggregate data exchange, how an ADX schema is created to validate ADX data message exchange, and also the enhancements we've made on this profile. So a little bit on the background, aggregate health data reporting is going on in most countries in the world in order to generate national or global health indicators for monitoring programs. In the last few years, use of electronic sources of data, such as electronic medical record system, have increasingly emerged and adopted. However, we still see routine reports printed from one system and data re-entered manually into another system. Also, the lack of widely adopted internationally recognized standards for representing and exchanging aggregate data has led to use of ad hoc and de facto methods. So what is the value of ADX profile and why should we use it? The first thing is it can meet reporting requirements in a variety of resource and technologically diverse settings. The second one, ADX profile is a significant step in advancing the use of standards for aggregate health information data flow. ADX profile can support health data workflow at local, national, and global level, as well as facilitate electronic aggregate data reporting to improve on the low labor-intensive and error-prone manual reporting process. So on the technical solution of how ADX solve this problem, ADX profile specification describes a simple exchange format that is designed to be used for a diverse range of reporting requirements. The specification describes the creation of ADX data structure and data content. As you can see on the diagram, the data structure specification describes constraints of the ADX data structure definition, which is defined using statistical data and metadata exchange version 2.1 standard DSD. It also describes how ADX conformant message schema can be generated from ADX DSD by the content data structure creator using code lists such as data elements, facility list, reporting periods, and others defined by the implementing jurisdiction. On the data content, the profile describes how a content creator creates ADX conformant messages and exchange them with the content consumer. The schemas generated from the ADX DSD can be used to validate both the structure and the content of ADX message. So next on how can ADX be used? This slide highlights two common use cases that are used in most countries for aggregate data reporting. One, the one that is shaded in blue, is the monthly reporting of aggregate data from health facility EMRs to the national HMIS. And the second, which is highlighted in green, is reporting indicator data from a country HMIS to the global data repositories, such as the WHO Global Health Observatory, or data for accountability, transparency and impact, a system used by the US President's Emergency Plan for AIDS Relief. To date, several EMRs used globally have been enhanced to generate and transmit ADX messages for routine reporting. Also, data which is based on DHS2 has been enhanced to generate and exchange and also process ADX messages. Just to note, ADX is currently used in over 40 countries, supported by PEFA initiative for program planning and monitoring. So on the next slide, it's just a highlight of the the enhancements we've made in revision 2.1 of ADX profile, which was recently released for trial implementation. The enhancements we've made is one, being able to better handle data element disaggregation, as well as validation of the structure and content of ADX message using a W3 XML schema and an ISO schematron. Transport specification for posting ADX content using HTTP request has also been added. The ADX post content uses two methods. The first is when asynchronous is false, which means that ADX post results are received by the content creator immediately after the data message is received and processed by the content consumer. And the second is when asynchronous is true. The message is received by the content consumer and queued for processing. And an ADX post result is sent after the data has been processed within the system. So I'd like to encourage all of you software application developers, implementers, and vendors to leverage on the ADX specification and profile for aggregate reporting, especially its ability or capability to support a diverse reporting requirement. The upcoming connectathon will be a good ground for you to start testing your system with ADX profile. Thank you. I'll take it back to Derek.
James, you guys are making my job so easy. I'm not having to ring the gong on any of you. That's very well done. You also came within your time, and that was an excellent presentation of the ADX profile. Thank you for that. I'll open the floor for questions for James. I happen to have inside knowledge about this profile because I'm a project manager on one of the programs that makes heavy use of this. I don't know if others on the call were able to follow what exactly is the primary use case for ADX, but the President's Emergency Plan for AIDS Relief, or is known by its acronym PEPFAR, funds programs in 58 countries that are providing HIV treatment and supporting HIV drugs in those countries. And as one would imagine, there's a significant burden of data to be collected to find and to track and to manage the programs in these multiple countries. And the aggregate information on a monthly basis and on a quarterly basis and on an annual basis is being transmitted using the ADX profile. It's a significant use case, and this profile has solved a problem that we were having literally all over the world in managing this US-funded program. If there aren't any questions, James, I thank you again for an excellent presentation. I'll pause. Are there any other questions from the floor?
I do have one question. Sorry, I have some echo. This is Donna Medeiros. James, you always do excellent presentations, and I know your work is proven in Africa. So I'm going to ask this question on, it goes to capacity building for this profile, this standard for those systems that are out there that aren't maybe open source or haven't quite understood how to do the uptake of this. And we know there's a lot of EMRs out there on this use case. How do you suggest we get this resource out there to folks so those other EMRs, not the large ones, but in the LMICs, get this information and get capacity building in this?
Thank you, Donna, and thank you for keeping track of all this work and what you've worked over time. One of the things, and we've had discussions around this, in terms of capacity building, there are several things we are doing in terms of ADX. And the first thing is to educate people on the importance of standard-based data exchange. And that's one of the key things for countries and developers to take that up. Because once they see the value in that and the value in not only standardizing how systems generate data, but also standardizing the data itself, is one of the key things that we have been working to educate people. And one way is through these webinars and also working directly with countries to share these. The second thing we've been doing in terms of capacity building, I've been engaged with several developers and vendors, and what I do is work with them through the process of implementing the ADX profile in their system. So some of the things we do is being able to test the ability to generate an ADX conformant message, and making sure that we can process that in a national HMIS system. Part of it is it's still nascent in most countries, but one of the key things is to get governments to embrace the standard-based approach in terms of how they organize their data. So right now we are working along with developers and implementers of those systems. Hopefully soon they'll be getting back to us, and they've done that especially for the enhancements we did. Get back to us with feedback on how we can enhance that and make it practical for them to implement it. Thank you.
Thank you, James. Donna, it made me smile from ear to ear to hear your voice. Thank you very much. Donna Medeiros is with the International Rescue Committee. She is their Global Director of Informatics. Welcome, Donna. Are there other questions for James?
Hi, this is Santos at CDC. I also work with James, and just to Donna's last question, I wanted to add that we, of course, welcome, we understand this is a huge sort of dissemination effort, and we welcome other people's suggestions about how we might disseminate as broadly as possible. I know there are existing avenues, and we're trying to meet as many of them as we can, focusing so far on building the materials that would be useful for broader dissemination, but then we probably need some help in terms of disseminating as widely as possible. But I just wanted to explicitly mention that we also are engaged with the World Health Organization to develop a policy level framework that promotes the sharing of data, which is already been on record, but exactly how that manifests through things like ADX could use a little bit more specificity, but it's an important part of the strategy.
Thank you for that, Ben. You made me smile as much as I smiled for Donna. I'm glad to hear that you're on the call as well. James, thank you so much for an excellent presentation, and thank you, Donna and Ben, for your comments and questions.